Most people that have lower back pain get told it's because of anterior pelvic tilt, but they never get a proper explanation why or any practical solutions to fix it. So here's a case study of one of my patients and what we did to get him out of pain. So initially he presented with pain right about here, and after a brief assessment, two things became clear. Pushing him into internal rotation at the hip recreated his pain, and anterior hip impingement was present on the exact same side, which was aggravated by lifting his knee to his chest. So what does that have to do with anterior pelvic tilt? Well, when the pelvis is tilted forward, it shuts off access for the femur to lift into flexion. Hence his discomfort to lift his knee to his chest, which further restricted his ability to internally rotate at his hip. And the reason I know this is because when we did these next two exercises, his pain disappeared. So we know we're on the right track. Firstly, we started him on his back with his feet elevated slightly and firmly grounded. We also added a foam roller between his knees with a gentle squeeze to promote a little bit of internal rotation and maintain alignment. Now, the big cue to get him to rotate his hips was to imagine he had a towel and he was going to tuck it between his legs, and then think about dragging his heels to his bum. And at this stage, his hamstrings were on fire, which is exactly what we want. Secondly, we needed to recreate space at the front of his hip through active internal rotation. So we use this exercise from the Pelvic Restoration Institute. So in the side lying position, his feet were flat on the wall. The goal was to actively squeeze down and back on the foam roller to force his hip into internal rotation and gradually create more range and space throughout the joint. So this is an early stage rehab plan to activate specific tissues to realign his pelvis. And as I said, subjectively, his pain had disappeared. And when we retested him, his discomfort was not being recreated. So we are on the right track.